It's very moving for me to be together with a lot of colleagues and teachers in this effort. And it's just nice to be here 10 years later and to see everybody well and vigorous and with a lot, I think, that we can be proud of 10 years on. Let me respond to the critics first. We didn't solve all the problems in the world. And that seems to me what the critics of these papers say, and I'm going to put aside that criticism mostly because I think it's mostly silly. Every few years you need to reinvigorate a battle, and every 10 years or so there is a need for a new updating. But I don't accept any of the carping in these papers, I have to say. I think it's completely wrong-headed, disingenuous, or just misunderstood because we fought a very good battle 10 years ago and were right, and the last 10 years have been good but insufficient. And now we have to fight another battle, and in 10 years we'll have to fight another battle, and in 10 years we'll have to fight another battle because that's how life is. The world is never going to settle down. It never has, and it never will, to God's kingdom on earth. It will always be our responsibility every few years to help understand the context that we're living in and the steps that we need to take. This was science-based politics. Let's be clear about this. It was rigorous and it was scientific, but it was politics. Politics in the best sense of trying to bring the people together around shared ideas, and politics in the specific sense of trying to use political processes and institutions to mobilize resources. And it succeeded in that in important ways. It didn't succeed in everything that this commission called for, but nothing succeeds in everything that you call for. In this world, to succeed in anything is hard enough because the world in many ways has tendencies to fall apart, and the commission definitely accomplished a lot. I'm very proud to say on behalf of all of the commission and the hundreds of people that worked on it. Let me take us back to the situation in the year 2000. And I'm going to be very pointed and very blunt, and one can consider it however you take it, but I'm going to tell you, as I always do, how I saw it then and how I see it today looking back 10 years, just to be clear on where we were and where we are today. So 10 years ago, 11 years ago specifically, when Gro Brundtland, one of the world's greatest leaders, conceived with a number of colleagues here the idea of this commission, the world of public health was in dire shape. And I always found it especially poignant that we reached the year 2000 not with health for all, but with three fulminant pandemic diseases underway, AIDS, TB, and malaria. AIDS, of course, the worst pandemic of modern history. TB running fulminantly out of control with extreme multi-drug resistant TB and with just multi-drug resistant TB, and malaria having also passed a disastrous threshold when frontline drugs like chloroquine had lost their effectiveness, and the disease was spreading for that reason and many, many other reasons. There was no health for all. There was an unmitigated disaster. The way that I got into this myself was starting from a situation of pretty large ignorance. I began working in Africa in the mid-1990s and was absolutely blown away by the amount of death that I was encountering on a daily basis among counterparts in ministries of finance and central banks. And I was also completely stunned by how much malaria was around, and children of colleagues, children everywhere, malaria. Everyone was sick from malaria. Everyone was down with malaria. Everyone was suffering a loss of a friend or a child of a friend from malaria. And this also completely stunned me because I knew very little about it and thought malaria was something that had been relegated to the textbooks, to just give you a measure of how ignorant I was about this. And I spent a number of years at the end of the 1990s trying to understand this. And one of the things that I spent time on was trying to measure what we were doing about these things, which was not easy, by the way, because even till today, except for the data gathering power of Chris Murray, we know very little about many things that we do. And it was not possible to get statistics that were meaningful and measurable about the investments in disease control. We had plenty of speeches, like we always do, plenty of hand-wringing, plenty of declarations about how AIDS is the central challenge of our time, plenty of declarations about how important it is to fight disease and save lives. But after a bit of sleuthing, that took some time, colleagues and I were able to determine that we were spending almost nothing on any of this. And there was not only almost nothing being spent, under $100 million a year for AIDS and under $100 million a year for malaria control, both prevention and treatment. There were lots of speeches and misdirections covering up a world that was doing almost nothing, and a world that had gotten completely, absolutely used to leaving millions of people to die of completely preventable causes. We still live in such a world, to be sure. Our world is capable of letting mass death occur with hardly batting an eyelash, and we should never forget it, because it is, for every one of us, every day, the true moral condition of our planet, which is the vital vulnerability of impoverished people and minorities and excluded populations, and a world that is noisy, crowded, distracted, and institutionally unable to keep a focus on important issues in the midst of rock stars, celebrities, basketball games, cricket matches, TV shows, American Idol, and all the rest. That's the world that we live in. Our responsibility is to do something about that every day. And that is to keep track of what's important, which is that there are people without voices, without means, without colleagues in high places whose children are dying. And it's our job to actually try to address that. So when the commission began in the year 2000, we had a fulminant crisis, not only of pandemic diseases, but of public health itself. The amount of financing for health was minimal. The ambition was minimal. The only thing that was in good supply was speech making. And we met, and I remember the first day of the panel, I said, you know, we may have to call for as much as $10 billion a year of aid. And a lot of the commission was pretty scandalized by that. It was our opening discussion. Because maybe it would be $3 billion, Jeff, maybe let's be careful, let's not go too far, and so on. And I think we all agreed that we'd let the evidence take its course and we would do this properly and rigorously over a two-year period, which is exactly what transpired. We had three charges of the commission. One was to understand the links of health and economic development, and we mobilized evidence that I think has only gotten stronger over the last decade that population health is a critical component of economic development, and population disease burden can be a critical barrier to economic development. And I think the case for that is strong and, in my view, irrefutable. The second thing that we looked at was what can be done. And we took the view, and it has its problems, and there were critics, some of whom are in the room, and I think the criticisms were well taken in some ways, but we took the view that we would look at the excess disease burden between rich and poor countries and focus on the interventions that could address the excess disease burden. That led us to focus on category 1 disease conditions, meaning infectious disease, nutritional deficiencies, and childbirth-related deaths, both of mothers and neonates. We did not spend much time at all on non-communicable diseases, and Derek was a good constructive critic of that. And there's a lot of merit in that criticism, but this was the focus, category 1 of the commission. We identified, and I think Lancet has been the world center place to go for this then and now, that there are things that are known, rigorous, both protocols, diagnostics, medicines, preventatives that can make a huge low-cost impact on this excess disease burden of category 1 diseases. And I would say if you collect the Lancet papers in these areas over the last 10 years, they constitute really the practical textbook of how to and what to do in very pragmatic, programmatic, algorithmic approaches to control. And our approach was similar to that, which was to document that in every case, including obviously AIDS, TB, and malaria, but other waterborne diseases, pneumonias, safe childbirth, nutritional deficiencies, and so on, there are a known group of interventions. And Dean Jameson, of course, has literally put together the book on several occasions with the disease control priorities for developing countries of what can be accomplished. And I always felt my job as an economist, who is obviously a visitor to this field, was to channel the knowledge of what I like to call the epistemic communities in each case that things can be done. The oddest part of our world in general is that the people with the most knowledge often have the quietest voice. And I will never forget Chris Curtis, for example, the world's leading expert on malaria bed nets. Very quiet person, and not one who would or could lead the global campaign by himself to get bed net coverage. But I always felt that my job and our job was to help him achieve what he had discovered to be the right approach. And so channeling the epistemic knowledge to practice is what I regard as the vital role of the Commission's work. And that was the second area. There is practical knowledge that can be applied. And the third part was to do the costing. And Mills and her team did a lot of the costing. I've been involved in a lot of costing exercises then and since. And the basic point that we made, and that I think is absolutely true, is that at low cost, millions of lives can be saved per year. And though it's low cost, it's too high a cost for the poorest places in the world. This is the hardest thing to understand, I think, of this whole effort, which is that poverty is really a life-taking trap. that it can really be the case that even a $5 bed net to cover every sleeping site is out of reach of an impoverished society, no matter how you slice it. And the donors like to slice it every way but the truth most often. And that is, they want first social marketing, then they want community this, then they want government budget that. And it's all phony because you can shift the stones any way you want, but you still are not going to get water out of them. You need to find the resources, and when people are impoverished and living in the least developed countries, they need help if they're going to stay alive. And so the failure to help is also the moral failure to keep people alive. It's also the practical failure to help stabilize impoverished countries. It's also the economic policy failure to help break poverty traps. It's a disaster to leave millions of people to die every year in impoverished countries on every count: ethical, security, economic, political. Yet that was the way that things were in the year 2000. So we came up with a price tag that was roughly 0.1% of the GNP of the rich world. We still struggle against that standard. That's about $35 to $40 billion a year right now. That is the incremental cost needed to close financing gaps. It's a tragedy and a joke how small this number is. It is just by itself well under half of what the United States wastes in Afghanistan every year, for example. It's about 25 days of Pentagon's, it's actually less than that. It's about 20 days of Pentagon spending. In other words, people die for the absolutely stupid reason that what are macroeconomically tiny amounts are very, very difficult to raise. And I suppose the thing that I added to this process was to keep explaining, which I will do to my death, how small these numbers are. These are just tiny amounts compared to things that we easily find for bankers' bonuses or wasteful wars or tax cuts or any other category that is nearly useless in comparison to the challenge that we face. So the Commission had those three mandates, and it honored them, and it produced a bit of a breakthrough, without question, in my mind. I've been on the inside room for this whole process for most of the last 10 years. I have no doubt that the Commission's report played a fundamental role in changing the texture of the discussion around financing for health in low-income countries. And I've been in the Oval Office on this, and I've been in 10 Downing Street, and I've been in leadership sessions everywhere, and the Commission work played a tremendous role. I'm very proud of it, and very proud on behalf of everybody involved. It helped to create a number of institutions, the most important of which has been the Global Fund to Fight AIDS, TB, and Malaria, which I take to be a direct result of the Commission's work. I called for a global fund in the middle of the Commission's work at the Durban conference in 2000. I can tell you the nature of Gro Brundtland's leadership. I was flying into Durban in the summer of 2000, reading a World Bank article on AIDS, getting more and more agitated, finally handing over the Science magazine article to my wife saying, Sonia, where is Sonia? Yes. Sonia, am I wrong? Go through this. Am I correct that the word antiretroviral doesn't appear once in this article in 2000? And we couldn't find the word one time in a World Bank survey article about what to do on AIDS. This is the evil that can infect the donor world and the rich world. It was politics then to not admit of the possibility of treating poor people with AIDS. And so this article had bereavement training as one of the recommended interventions, but it did not mention antiretroviral medicines. I can tell you by the time I got off the plane, I was pretty agitated, and those of you who know me know that I can get pretty agitated. So I stormed into my session, and I, by then, had a PowerPoint which said that the World Bank was derelict in its duties, had failed the AIDS pandemic, and we needed to create a global fund to fight AIDS. When I arrived in Geneva Monday morning, the first thing was a call from Dr. Brundtland's office. And she asked me to come upstairs, and she said, Jeff, did you give a speech this weekend? And I said, yes. She said, did you mention the World Bank in that speech? I said, yes, Gro, I did. She said, you know, Jeff, I got a call from high level at the World Bank this weekend. So I just want to tell you, keep doing it. And that was that is Gro Brundtland. And that is the kind of empowerment you need to make change. Without that, you cannot make change in this world. If you think this is going to come easy and that it's going to come without a fight, you're wrong. And so that was the fight we were in. And by the way, the commission was pretty uncertain about antiretrovirals till the last session, about how we would call for them, whether we would call for them, how strongly we would advocate for them, and so on, because this was the mantra at the time. Couldn't be done, shouldn't be done, and we faced opposition. We had leadership like Gru and Kofi Annan that set a very high moral course, which allowed this breakthrough to take place. And amazingly, George Bush played a major role in this as well. In April 2001 in Abuja, Kofi called for a global fund to fight AIDS, TB, and malaria that I had worked with him on, using the basis of the work of the commission and referring to Paul Farmer's pioneering work and pioneering work by Médecins Sans Frontières and others. And in May, there was Kofi and President Bush standing in the Rose Garden saying that a global fund would go forward. And it's an amazing, was an amazing phenomenon. I personally recommended to the US government PEPFAR in February 2001. I gave a document to Condoleezza Rice calling for a $3 billion a year AIDS scale-up program. And I was led out of the White House by a former student of mine, Larry Lindsay, who put his arm around my shoulder as he guided me from the West Wing, and he said, Jeff, that was a great presentation, but you don't stand a chance. It's not going to happen. And said it's too much money. You never know, ladies and gentlemen. It's, of course, a tiny amount of money, and it did happen. It happened in no small part because Bono and Jesse Helms read scriptures together. This was not in our vision or script at the time. But one day, Bono called me as I was driving home from work, and he said, Jeff, I think you better pull over. And I did, and he said, Jesse Helms just blessed me and said he would support our work. And Helms called the White House, and I quote, Mr. President, you take good care of this boy, referring to Bono, because he's doing the Lord's work. And the religious community rallied for PEPFAR, which was finally announced 2 years after I first made those presentations at the same $3 billion a year. And that started the PEPFAR program. PMI had the same origins. It took longer. But finally, after a lot of screaming on my part at a lot of White House officials that this was the cheapest possible thing to do in the world, Bob Zoellick, as Deputy Secretary of State, took it on for the 2005 Glen Eagles Summit, and it became PMI. These are all direct fallouts from our work together. Everyone required a lot of advocacy, a lot of pushing, but basically representing knowledge, science, and decency. And that's the fight that we are inevitably in, because we're not politicians, but we know more. And I say we because I'm invited into the knowledge communities of public health, but it's making that translation and then keeping an absolute fight to defend the truth and to defend justice that makes this possible. Because the aid agencies are instruments of state, and government by itself has no natural compass towards truth or justice. So to be steered and to be guided requires a lot of pressure and a lot of knowledge, and that's where a commission report can play an enormous role. We were very lucky to have Manmohan Singh on the commission, because not only is he a great man, but he became Prime Minister of India. And as soon as he did, he said to many of us, and Sujatha and myself and others who had worked on this, I want to take this to India national scale. And the National Rural Health Mission became, I think, a direct response to the commission work. And when you see an Indian Prime Minister, as I do frequently, you appreciate how little time they have as they govern a 1.2 billion person society, so you never take much time on anything. And the Prime Minister always says to me, every single time I see him, please keep track of NRHM, just please make sure it's working, and if anything's going wrong, let me know. And that's all we talk about. We don't talk about any of the substance on it, but he conveys to me every time that it's a personal interest of his that the work of the National Rural Health Mission go forward. So let me bring us to today. Some of the criticisms say we didn't solve the environmental problem. True. We didn't address climate change. True. We didn't do many things. Absolutely true. We didn't even reach the financing goals. True. Though the scale up of development assistance has been marked, and the one thing that has been proved, in my view, beyond a doubt, is if you put money into this, you get results. Because every claim that was made about bed nets being converted to wedding veils or to fishing nets, or antiretrovirals being stolen and unused, or about Africans who can't tell time, and many things that were said over the last 10 years were proved to be the garbage that they were evidently at the time. And I say that because these were not things said in good faith. These were things said, even if not in bad faith, through immoral ignorance. Because when you're speaking about life and death, you have an obligation to be serious about what you're saying. You can't casually say things about bed nets as wedding veils or fishing nets without moral responsibility. And so a lot what was said ignorantly. It wasn't necessarily said with evil intent or to subvert programs, but it was said immorally, because issues of life and death carry a moral burden to know what you're talking about. And what happened over the last 10 years shows beyond any doubt that global health works. Global health as a field works. It's a systematic field. It takes epidemiology, burden of disease, designed interventions, management and delivery systems, monitoring and evaluation as a package for getting from basic knowledge to better health. And it is an effective human system. Of course, it stands improvement, it stands refinement, it stands advances in knowledge, advances in medicines, diagnostics, techniques, but it works. And millions of lives have been saved, and more than that, hundreds of millions of lives have been protected by the interventions that have been done. Where are we today? And I'll finish up here. We're at the next crisis. And that crisis has a number of components to it. The most important component is that all multilateral processes are failing right now. Everything. Whether even the Eurozone can survive is a question mark this morning. Durban is a breakdown. We will have Rio plus 20 next year with 3 environmental treaties that all failed. The Climate Change Treaty, the Convention on Biological Diversity, and the UN Convention to Combat Desertification. 3 wonderful treaties, all failures by standard of application. This is the world that we're living in right now. The US has ceased to be a leader. This is unusual for us because we relied on US leadership for a long time. The US is now the most conservative force behind the scenes in the international environment. It blocks almost everything right now. Can you imagine that the US climate negotiator in Durban is making the claim we're not really trying to stall everything to 2020, only to 2015, which is tantamount to what Todd Stern is saying right now? It's pathetic, but it's the reality that we're living in right now. We have at least half of the Republican candidates for president saying they want to eliminate all foreign assistance. We just had cancellation of round 11 of the Global Fund round, which I regard as the single biggest setback to the Millennium Development Goals since their start. Because if the Global Fund cannot fund new rounds, we will not even sustain what we've done, much less continue to make progress. So this is the single most dire setback to the Millennium Development Goals since the beginning of the process. And all of this is around the fact that our governments misallocate money massively. $700 billion for the military this year in the United States, but we can't confirm $1.3 billion to the Global Fund commitment. That's a shame, and it's a tragedy, and it's an error, and it's a measure of ignorance, and it's a measure of irresponsibility. And I hold a lot of people responsible, including the President of the United States, whose job it is to protect those who will die without his leadership. And we saw more leadership from George W. Bush than we have from Barack Obama on this, and that's not acceptable. So we have really a serious crisis right now, even to hold what we're doing. On the other hand, we have some remarkable positive trends as well, and let me mention those because life's complicated and it's a balance of negatives and positives. So first, our technologies are vastly better now than they were 10 years ago. We can do things that we didn't even dream of 10 years ago. Malaria control has been revolutionized within the last 10 years. That you can do rapid diagnostic tests in the field, that community health workers can have smartphones with expert systems on them, as Lancet recently reported, and we do in our own Millennium Village project, so that village workers, not trained microscopists, but high school graduates in the village, can be empowered to treat malaria in the homes rather than having mothers carry their children on their backs for 10 to 15 kilometers, as used to be the way that malaria was faced. We didn't even have long-lasting insecticide-treated bed nets when we issued our report. They were just being tested. Bed nets were not retreated, and we know that the effective action of bed nets without retreatment is less than half of the efficacy with treatment, because you lose all the excitorepellency from the insecticide. You may keep the mechanical protection, but no more. And now we have 5 to 7 year bed nets that have transformed the control, and we're seeing a steep drop of malaria in many parts of Africa right now for the first time. We know a lot more about how to organize on the ground. Many poor people live in middle-income countries now, so that means there are more resources available. India is taking on a much greater responsibility. China no longer has extreme poor. And many other countries like Nigeria are using their own revenues now for scaling up. So this is all dramatic progress. I believe that for the next 10 years, we have to consider the basic strategy that the Commission exemplified. It didn't invent, but it exemplified. And that is identify the disease burdens through solid epidemiology, identify the interventions that count, shape, design, and cost the effective systems to apply those interventions, and then mobilize the financing from a variety of means to get the work done, and for the knowledge community to find the voice robustly to say that this can be done and it must be done. Thanks very much.